Hi guys, I'm Renee. I'm an epilepsy warrior from WA. Today I want to talk about epilem or sodium valproate. Now, as I have said in many of my other videos, they don't tell you a lot about this medication and some of the side effects. And I have been listening to a book this week, how your body remembers, to deal with PTSD and some of the trauma that I have been through as well. And one of the things that the doctor mentioned in the book was that sodium valproate, which some of you may know already, is actually used for bipolar patients. They use it as well to try and calm down the manic episodes and things. What you may not have known is it actually decreases your dopamine, which is the pleasure hormone in your body and the motivation. Now, I have been on this medication since I was 14 years old and I can't get off it. And that's something also that he mentioned. Once you get on this medication, it's very hard to get off it, which they never told me, obviously, when I was 14. I doubt my mother ever asked these questions. That's why I say it's so important to find out about this medication, especially before you put your child or before you go on it yourself. They put me on it when I was 14. I had a terrible depression and I piled on the weight. I put on 20 kilos when they put me on this medication. I was 40 kilos, I think, when I was 14, before they put me on it, and I went up to 60. Now, they didn't tell us any of this. They didn't tell us about the side effects, which I have mentioned before in my videos. The neurologists don't tell you. All they want to do is get the seizures under control, which is the main goal. But you also have to live. Once you have the medication and once you have the seizures under control, you still have to live. Like for myself, I haven't had a seizure in 8 years, but I'm having to take this medication every day, and it is hard to deal with the side effects because they're still affecting me today. I'm on Keppra 3,000 milligrams and 200 milligrams of epilem, which I take at night. But I do still feel the lack of motivation. It's hard to get up sometimes. All I want to do is sit on the couch many times. And God, man, if I could get off this epilem, maybe that would help a little bit. But, you know, I can't get off it now. Every time they have tried to take me off it, I have had a seizure. And because I am 8 years seizure free, I do not want to mess with my medication anymore. I don't want to take that chance. But please, I beg you, ask the questions. And if the doctors aren't giving you the answers, then look up the information yourself. Don't put your child on epilem unless as a last result, especially for girls, because epilem causes birth defects in children. And like I said, I have been on it since I was 14. It took me 10 years going on, off, before they managed to get it down to a small enough dose that it was safe enough for me to have children. So please, use epilem as a last resort. I know Keppra is a bitch. All the epilepsy medication stinks. It all has horrible side effects. But as I say, the main goal is to get the seizures under control. But you have to live afterwards as well. And I'm 45 and it is hard. It's great I don't have seizures anymore. But it is hard when some of these side effects, I mean, the memory loss I'm dealing with these days is really hard to deal with. I forget things so easily. Things that I'll do at work, I'll forget how to do the next day and I have to look on my notes again to remember. It's hard part of epilepsy. And even when your seizures are under control, the struggles, they don't go away, man. They don't go away. So let's stay strong. Let's ask the tough questions. Don't let the neurologist say, oh yeah, this and this. No, you want to know exactly what that medication does to you. Like, they did not tell me that it decreases your dopamine. That is a big thing. That is a big thing. That is the pleasure part of your body. How depressing. And they wonder why people, and that's why they say that these medications can cause suicide. Because if you're not happy ever, you know, what's the point? It's a hard yard. You have to find other ways, and that's what I'm trying to do, find other ways to increase my dopamine so I am happy. You know, I have my 2 kids, and my husband. I have a great family. That is my pleasure. But still, you need a bit more than that. You know, not everyone has that. Take care. I hope this information is helpful. Don't stop taking your medication. Just ask the tough questions and don't give up. Take care. Stay seizure safe. Bye.